Hey, it's Dr. Manny from Breakthrough MD. There's a lot of talk now around value in medicine. So, one question I get from my clients is, okay, so how do I increase the value of my MD? I have this MD. I've done my fellowships. I've done my residency. How do I make more money? How do I work less time, generate more revenue? How do I put myself in a position where I feel like I'm doing more meaningful work and surrounded by people who value me more? So there's a story I like to use as a teaching story for this. It's Joshua Bell, award-winning concert violinist. As a social experiment, they put him in a subway at a DC Metro, and he put out his guitar case, his violin case, and 45 minutes he played beautifully. People just walked by, busy, went about their way. And there's a lesson in there. It's after 45 minutes, I think one lady dropped some money in there because she recognized him. But there's a lesson in there, and that lesson is about perceived value and where and how you're most valuable. So, as a physician, the tendency is to work harder and assume that that's going to make you more appreciated, make you more valuable. But when you look at the data and when you look at marketing strategy and positioning strategy and even a lot of the sales knowledge that they've accumulated over the millennia, sales is the oldest career, by the way, contrary to what you might have heard. So when you collect the data, it turns out that there are three elements that go into making yourself valuable. First element is mindset. Second element is skill set. Third element is environment. Your mindset, if you don't have a mindset, a growth mindset, which means that in any given situation, you're looking to see how I can add value to the situation. Because value is something that happens in your mind and in your customer's mind, your patient's mind, whoever you're interacting with. If you don't have the mindset of flexibility to figure out what that person values, develop the empathy to understand what they need in that situation and cater to that need, when you walk away from that transaction, it's not a valuable transaction. That's one level where you're devaluing your MD, and you can increase the value of your MD by understanding the role of mindset in that one situation. Situation two, skill set. Systematically, we're taken through an education process in medicine where we learn diagnostic skills, we learn building skills and coding skills, we learn procedures. But when we're thrown out in the real world to practice, we find that we don't necessarily have management skills to run a unit, to run a clinic effectively based off the latest science. Because sure, you can try to run your unit like you ran residence, but the dynamic is quite different. You don't, you're not, the whole command and control dynamic is gone. So it's worth learning skill sets, including communication, um, learning emotional intelligence, learning negotiation, learning enough sales and marketing so that you're able to reach into the market and you're the one determining what your asking price is. This is as opposed to um, going through the back of, and my training is psychiatry, so I'm going to say in the back of the psychiatric news, looking in the back and seeing who's paying whatever salary and taking that position, moving your family to there, learning the skill set of attracting the revenue to you, attracting attracting the people that pay the money, attracting the circumstances through intentional pursuit of your goal in the context where you are. That's the skill set. So that's two. Three is environment, and I mentioned that a bit in the skill set aspect. But when most people think of environment like, oh, I'm going to work in New York, I'm going to work in Philly, I'm going to work in an academic institution, I'm working in a small clinic. But in reality, you want to think of environment as the people you're working with, their mindset, the skill sets that they expect from you, how much they appreciate what you're doing. In marketing, we call that as positioning. If you're attracting negative people or complaining people, if you're working with people who are critical of everyone, then that's a toxic environment. You're not going to get valued. Doing more work, doing the other two in a toxic environment will not get you made more valuable because you're dealing with a system that is incapable of appreciating value. Sort of like Josh Bell's experience in the subway. It's not like Josh needed more practice. A lot of physicians, you don't need to become a better physician. You need part two, the skill set of differentiating and discerning when you're in an environment where they don't appreciate people, when you're in an environment that's toxic, when you're interacting with someone who is projecting their issues onto you and not internalizing it and not letting it bother you and moving on. And sometimes it's just a matter of um, knowing when to let it go. Um, and that could be something as extreme as moving from clinical medicine to academic medicine, a different kind of practice, a different community where a more conservative, a more liberal, to go political community, a more academic, a more rural practice. Maybe you just need to move to management consulting. Maybe your skills are more suited for that. Maybe you need to move to a more intuitive, holistic approach to medicine. All these environmental factors affect your perceived value. And so learning to check on each of those three things and adjust them accordingly is how you maximize the value of your MD. Now, one of the most important elements is to have an outside view. I provide that outside view to my clients, and with the life coaching that I do for physicians, I help them see their full potential, what they can become, and I hold them accountable for stepping through the ringer. Uh, what makes what I do different is that despite my psychiatric training, I'm not applying a diagnostic approach to to my transactions. I'm not sitting there looking to see what label to apply. My goal is to get each one of my docs in tip-top condition. My thinking is, if you made it through med school, you don't need a diagnosis. You just need coaching. Um, so send me a private message so we can get you on the track to maximizing the value of your MD. Dr. Manny, Break the Cage MD.